Great. Well, welcome everyone. This is Eric Oval with Okra. This morning we are going to be discussing and doing an overview of our Phase 3 for our COVID response program. So our quick agenda that we will be going through today, we'll do some introductions, then we will talk about the application process, program guidelines, scoring, eligible activities, and then of course have a quick Q&A section at the end. So that will be what we'll be going over today. To get started though, I want to introduce our new executive director. Many of you probably know him or are familiar with him as he is the former mayor of one of our stellar communities. So Mr. Denny Spinner, our executive director.
Thank you, Eric, and good morning, everyone. Thank you for being here today. It's really a privilege to be working with you as Indiana Communities. I'm proud to be alongside you in many of my roles before and now as the executive director of Okra. And this is kind of my first event as Okra director, so thank you for being here today. Excited about this round of funding that we're introducing, and just to give you a little background, in our previous rounds, in round 1 and 2, we began in April and was one of the first agencies to address the COVID impact on Indiana. And you can see in our first 2 rounds on this slide across the state that the number of communities and have been helped and touched by this program. And we've awarded over 112 grants at this point, totaling $20.9 million. The number of businesses that have been directly affected by this are over 1,700 businesses, and over 9,500 jobs have been impacted by the programs that we've launched already in phases 1 and 2. As you know, that all of Okra's programming is developed to provide some capacity building to promote community prosperity and ensure that Indiana communities are ready for economic growth. Our 4 key competencies are, of course, infrastructure, capacity building, economic development, and quality of place. And these competencies help create a foundation that must be in place for rural communities to thrive. And partnering with communities across Indiana and creating that foundation is what really excites me about being part of this new position and working with you in this role. Of course, it's obvious that addressing the COVID-19 pandemic and its social and economic impacts are one of the highest priorities for Governor Holcomb and Lieutenant Governor Crouch and our agency. And in response to that, the eligible activities for this phase of the program is growing and adding to meet these competencies. We've heard from our stakeholders in the communities that the human element of this pandemic was needed to be addressed. So we didn't want to overlook that, and that's why, as you will learn today, mental health and child care services are among the eligible activities. The pandemic has also moved into many of our activities online, and that's why reliable broadband is becoming ever more important, and we saw that need. So funding public Wi-Fi locations is a critical need and something that is being eligible as well. And one other note to this, both entitlement and non-entitled communities are eligible to apply for these grants. So while we most regularly deal with the non-entitlement communities, there are programs here that entitlement communities are eligible for as well, and we would encourage them to be part of the application process. We hope by expanding the program that it will continue to be useful and impactful across the state. And I want to thank all of you for what you're doing to help your communities through this pandemic and continue to provide the services and the connectivity to our everyone in our communities at this point. So, Eric, thank you so much for introducing me, and I'll turn it over to him to run through the rest of the program. Thank you all for being here this morning.
Thank you. So with that, I would like to discuss the application process that we will use for Phase 3. We are, very happy and proud that we are able to offer a Phase 3 of our COVID response program. As Diddy mentioned, we know the need out there is so great. So the program officially opened on the 7th, with the webinar being today, the 9th. The application in GMS is also going to be go live today. So after this webinar, you should be able to access that application and begin working on that. Applications will be submitted in our electronic grants management system. So that is how all applications will have to be submitted. Proposals, which are just a draft of your application, will be due January 29th of 21. So you have a little, right around about 2 months to put your proposal together. During that time, our staff, both our community liaisons and our CDBG team, will be available for any questions or idea brainstorming that you want to do with us as you prepare your proposal. We are going to ask that proposals be fairly completed and your ideas be fairly developed when you submit your proposal, just so we can provide the most accurate technical assistance to you all as communities. Between the January 29th and the application due date of February 26th, that is when you will do your one public hearing that will be required, and we will be providing technical assistance. So it is important to note for this phase, we are only going to require one public hearing prior to application. As I mentioned, applications are due on February 26th of 21. Once those applications have been submitted, we will go into our scoring phase and threshold review, with a tentative date of awards being announced on April 1st. As you know, OCRA really likes to make sure that we meet those dates that we announce, but we also, with everything constantly changing, know that sometimes we just aren't able to meet those dates at the detriment of our programming. So April 1st is our target date, but depending on how everything goes, that may move. So that is kind of an overview of the application process. So now let's talk about some of the general program guidelines for this phase. So as Denny mentioned, both non-entitlement and entitlement communities are eligible for this phase. So traditionally, we only work with our non-entitlement communities as defined by HUD, but our entitlement communities in Indiana are eligible for these funds. So those are our communities such as our larger communities of Indianapolis, Fort Wayne, Bloomington, Columbus, et cetera. Entitlement communities, we know that you are used to directly working with HUD and not as used to working with us. So, of course, please reach out to our community liaisons or myself and the CDBG team, and we'll happily, meet with you and kind of introduce ourselves if you are interested in applying, just so you are comfortable with, taking advantage of this competitive opportunity. Eligible applicants, as with all CDBG programs, are towns, cities, or counties. So townships or unincorporated areas must apply through the county that they reside. So if you are an unincorporated area, you will want to work with the county that you are located in. Maximum grant amount is $250,000 per community, so that is per applicant. One big thing and change from our previous two rounds is that in addition to the lead applicant being eligible for this program and not having any unresolved monitoring or overdue documents for OCRA, you also must have received release of funds for your phase 1 or phase 2 applications. So we have a few communities that were awarded grants in phase 1 or phase 2 that have not yet reached release of funds. So if you reach release of funds by application, then you will be eligible for this program. But as with all of our programs, any community that has any unresolved monitoring or audit findings or overdue grant reports, they are also not eligible unless those items are taken care of prior to the application deadline. So if you are in these situations, please reach out to us and have your grant administrator reach out to us very quickly here so we can come up with a plan to get those issues resolved. On the national objective, as with any CDBG program, national objective is one of the items that we need to make sure is met, as this is the item that is most commonly where repayment is required. So for this program, we are looking at 3 national objective options. The first is limit LMI on an area basis. So this is using census data or an already completed income survey. We are not looking for communities to do new income surveys during this with this program. There's just the time is not available. So if you are doing an area basis, you are defining an area, and then within that area, at least 51% of residents must be LMI. And so with that, again, you'll use either census data or income surveys. The other option is LMI limited clientele. So that is where your activity is going to benefit a very defined group. And of that group, at least 51% are LMI. So there are 2 ways to do LMI limited clientele. That is a presumed class, which we have those listed out there, or do income verification. Now, we do require at least 3 months of data for this. So if you are looking at doing income verification and don't have 3 months of data, please reach out to your community liaison and they will connect you with the appropriate CDBG staff member to talk about what possible options we could look at to help you with this achieving a national objective. The third and final national objective that we will look at is job retention, LMI job retention, and this is based on the retention of permanent jobs, of which at least 51% are held by LMI persons. So with phase 2, we looked at this exclusively, and so basically this is where if a community is awarded a grant for grants or loans to small businesses, they agree to meet this 51% requirement. It is calculated using either our FTE calculation or the CDBG CV economic recovery form. So we have 2 ways of calculating the LMI percentage. We have forms for both that are very easy. We also have our expert in this area, Abby Chapman, on our team, and so she is a great resource that you can reach out to with questions. One thing to note that was a point of confusion with phase 1 and then phase 2, when you are awarding the grants to the communities, OCRA does need to approve those prior to you making awards because we need to check that LMI percentage. Because there is that risk of repayment if you are not meeting that 51%, we want to verify that that the businesses you are awarding grants to or loans to meet that 51% before you make those awards. Because that basically alleviates the issue if you are making awards and then don't, and then you'd have to do repayment. So we're trying to avoid that repayment. So that is why we do that approval prior to you making awards. So grant administration for this phase, as we have done with the other 2 phases, we are not requiring the use of a certified grant administrator. The main reason for this is we know that a lot of communities are interested in this program, and we have a limited number of grant administrators available in the state. And many of our grant administrators are already working on our regular CDBG grants. So there's a possibility a community would approach a grant administrator and not be able to find a grant administrator to apply for this program. So that is why we are not requiring grant administrators for this program. However, with that, we want to make it very clear that for communities that don't use a grant administrator, CDBG, it's a very complex program and requires a lot of time, resources, and communications. So if you are not going to use a grant administrator, please know that you will need to spend a significant amount of time, and you will be communicating a lot with our grant services team or your community liaison as you work through this. So just plan accordingly and make sure that you have the capacity to be able to this complex program. With that said, though, OCRA is here, and we have worked with many communities that were not able to use a grant administrator for phase 1 and 2. So, we will work with you, and we will assist you as much as we can if you choose not to use a grant administrator. So if you have any questions about that, don't hesitate to reach out to us, and we'd be happy to discuss further that piece. Grant administration, the actual allocation of cost for grant administration will be capped at 2.5% as it was in phase 1 and phase 2. These are reasonable and eligible costs associated with administering the grant. One thing we are doing that is a little bit different from previous phases and our normal programs is we are including any environmental review and labor standard costs within that 2.5% cap, and the cap applies to any funding source based on recent discussions that we have had with HUD. So basically with this, with the environmental and labor standards costs being rolled into this grant administration, most of the activities that we have are exempt from both labor standards and environmental review. So for example, environmental review is just the completion of the exemption form. So there is no cost associated with really doing a full environmental that we normally see. So that is why for this phase we are rolling that into the administration of this. Finally, for communities, if you are doing any procurement, so if you are procuring a grant administrator, an engineer, or any other professional service, you do need to follow the federal procurement guidelines regardless of the source of funding. So even if you are going to be using local funds to pay for a professional service, you still need to follow all the federal procurement process for that because this is part of a CDBG grant. And if you have any questions about the federal procurement regulations, again, please just reach out to us and we'll be happy to provide you some guidance on that. So public hearings. This is something that I know I've had a lot of questions recently related to our other programs. And so definitely understand that during these times it is difficult to do public hearings. So based on that, while 2 public hearings are still required per federal regulation, we are only going to require the first public hearing happen between proposal and application. So you only need to do 1 hearing by application. For those applications that are awarded, the second public hearing will be completed before the submission of your request for closeout. So we are moving that second public hearing pretty far down the process to where you are actually going to be completed with your project, and your public hearing is going to focus on the results of your project. Did it work well? What improvements could you make for future grants? What did you learn? What are best practices? That is going to be the focus of your second hearing. Your first hearing is still going to focus on your development. So what are those thoughts and feelings and comments from your residents about the proposed project, and then using those from your hearing to further develop your application and your activity. So as always, both public hearings require 10 days notice, with the 11th day from notice being when you can actually conduct the hearing. One of the big things that OCRA will continue to stress and continue to focus on, we are going to follow whatever guidance is out there from the Public Access Council. So right now, current guidance allows for virtual hearings. So you are able to do a virtual hearing for that first public hearing by application. If at the time that you are ready to do the second hearing, the Public Access Counselor has changed their guidance, then you will have to follow whatever that guidance is. Again, OCRA defers to the Public Access Council for what is required for public hearings. So if you have any questions about what is required, you will want to contact the Public Access Council office. And we can, and all of their information is available online, and they have a really easy form online that you submit. And I found that they have been very responsive to other communities that have submitted questions regarding conducting a public hearing. So now let's go and talk about scoring for the program. So scoring for the program is going to be made up of, should I skip a slide? Nope, okay. Is going to be made up of two kind of main areas, our database factors, and then of course our project design or scoring committee factors. So for our database factors, we are going to look at LMI percentage. Again, that is either going to be based on your census data or an already completed income survey. So if you are applying for an activity where, for example, for our economic development activities of grants or loans to small businesses, you will either use your census data or an already completed income survey to determine your LMI percentage. So that is the data we will use for that point. Local match. Local match is not required for this program, but for those communities that do want to provide local match with this, we are going to consider up to 10 points for local match. So again, it is not required, but we did want to reward those communities that were providing local match. So for example, if you are a community that has already put some funds or wants to put some funds towards assisting your local food banks, then those funds could be considered as part of your local match. Those are very easy. Our points are awarded 1% for 1 point. So pretty standard for what we do. As noted with previous rounds, we are going to look at your weekly continued unemployment claims for the county that you reside. This is up to 30 points. This is going to be based on at the time of application. So on the application date, we will pull this information from DWD and use it to determine the score that you receive for this. Please note this is based on continued unemployment claims, so this is not on new unemployment claims. There are two different numbers. We are looking at the continued unemployment claims. The next scoring piece for our database factor is focus on a disadvantaged population. So we are going to use the definition of a disadvantaged population that we have used for many years in government, and that is a population in which is economically disadvantaged in comparison to the general population. So, that fits right along with what we see in economic development of minority, women, or veteran-owned businesses. And so For example, if you are providing mental health services to a homeless population and that is your focus, then you would receive those 10 points. And then finally, the database factors of regional collaboration. So for this, we are defining this a little bit more than what we have in the past. We are looking at multiple communities coordinating or supporting a single activity. So this could be, again, a county and a couple communities working together. Maybe they're applying for different activities, but they're all going to be working together on those activities, and so they're showing their support via letters that outline how they will be actually supporting or coordinating. So this is a very specific, very intentional collaboration that we are looking for. If you have questions about this, again, please reach out to us. So the next piece of scoring is our design or development factors, or a scoring committee factors, depending on what you call them. So this is pretty basic and very similar to what we did in in phase 2. So it's broken down into description, need, and financial impact, 40, 70, 70. All of those points will be awarded by consensus of a scoring committee. The questions are in the instructions, which are posted on the COVID-19 webpage. So those questions are available to there. There's a little snapshot of the questions, but they are in the instructions. So you can use these questions as you are preparing and developing your application. But very standard process for the design and development factors that we use. I do want to really point out that we heavily encourage applicants to reach out to their community liaison for technical assistance. Our community liaisons have a lot of experience with the development of our applications and have helped a lot of communities in developing their applications. So they are a really great resource as we dig in to the development, or as you dig in to the development of your application. So really, really encourage you to reach out to your community liaison and get their input and technical assistance as you are developing that application. So one new additional thing that was added based on feedback we received on the scoring, we are adding some bonus points to the scoring. So these are 10 points possible, and this will be based on the the Indiana County classification system that was developed by Purdue. So basically, these points will be awarded for counties that are classified as either rural mix or rural counties, 5 points for rural mix and 10 points for rural. Those classifications are based on census data. So at this time, our understanding is they are current until 2020 census data is available. So while they were done in 2013, they are still current based on the data that they were calculated on. So again, these are bonus points, 5 for rural mix and 10 points for rural. And we will no one needs to submit anything or anything like that for bonus points for this. We will assign these once your application has been submitted. So eligible activities. So this is the overview of eligible activities, and we will be spending a little bit of time talking about the eligible activities because many of these are new to our CDBG program, and some of them have a lot of complexity and require a lot of capacity from the applicant and the community. So we're going to go over these in detail. But as Denny mentioned, we are looking at a lot of different ones, and all of them are based on the needs that we have seen that have risen as a result of COVID-19. And there are many things that are really impacting people very greatly that are, are things that we normally don't look at when we are looking at our community. And so that's why we are very, happy to be able to provide these new opportunities for communities for these areas that, we just know that so many are struggling in. So the first that I would like to talk about is mental health services. So, and the activity itself is providing new or expanded mental health services with focuses on domestic violence and abuse services, substance abuse treatment and recovery services, suicide prevention services, and other general mental health services. So again, our focus is on some of these areas that we have seen data that have increased due to COVID-19. In Indiana, we have seen an increase in domestic violence and abuse. We have seen an increase in substance abuse. We have seen an increase in suicide across the state in both our rural and metropolitan areas. But a lot of that is in our rural areas. And, even the general anxiety and depression that people are feeling is elevated. And in some of our communities across the states, there are no mental health services available. And so that is the, hope of this, is to help address some of this human cost that we are just beginning to see and may never fully understand that COVID-19 has produced. And COVID-19, and this comes from the isolation or separation people are experiencing, housing instability, and for some, just the decrease in physical health because they're not able to get out, or they're eating more unhealthy, or some, things like that. So one area, in talking with the Division of Mental Health within for the state, one example that they gave us was helping individuals that were recently incarcerated but released. So helping with their reentry from incarceration, their reentry into society. While incarcerated, many individuals receive mental health services and other social services that once they are released, those services are discontinued and no longer available. And so communities could use these funds to help those individuals. And this relates to, because jails and prisons have a higher risk of COVID-19 spreading, keeping individuals out of those facilities is of interest to communities. And if those individuals can, stay out of those facilities by providing those mental health and other social services, that is something that is a benefit. And so that is something that can be done with this program and help with that. Again, we're seeing increases in suicide and domestic violence. And so many of those services are seeing an increase in the demand for them, but they are limited by their capacity, both physically and financially. And so this grant can be used to, possibly help a women's shelter expand and, provide a space for 2 or 3 more women and their children so that they can get out of violent or abusive situations. So again, this is all to help that kind of human cost that we are seeing due to COVID-19. With this, this is one area that this is not an exhaustive list of areas within the mental health space. And so if you as a community have an idea of ways to help address the mental health within your community, but you're not seeing it on this list, please reach out to your community liaison and they'll connect with me and my team, and we can talk about your ideas and see what we can possibly do to make that meet an eligible activity and a national objective. So we definitely are really good at brainstorming and helping with that idea generation for many communities. I have lots of conversations like that with communities. So next, let's talk about childcare. So this activity is provide new or expanded childcare services. This is to go to operating costs, that's leases, utilities, things like that. This can be used to help existing services return to pre-COVID-19 levels. So returning to pre-19 COVID levels is considered expanding because you are at a reduced state. So this can be used to get existing services to pre-COVID levels. I want to point out, though, this is a short-term in nature. So we definitely understand that many child care services are struggling with reduced capacity and reduced financial resources because of the pandemic. And so this is meant to directly address the pandemic. And hopefully provide a time where the child care services can at least, instead of worrying about how to, pay their bills or provide services for a little bit, they can then focus on how they can become stable in the long term and address their long-term needs. So again, the nature of this is short-term for these services. And that applies to all of these services, but especially with childcare. And so one of the big things that the reason we're doing this is we've heard a lot from a lot of our communities that there are individuals that want to return to work but are not able to because there's no childcare. It could be that they relied on their grandparents to provide childcare, but because of the pandemic, they're concerned about doing that because there's risk of those grandparents getting sick with it and not being able to recover, or their child care facility had to reduce their capacity to meet social distancing standards. So we know, and because they're not able to return to work, that is causing a lot of other issues. So for them, whether that's they're not being able to pay their bills or things like that. So we see this as one of those kind of root causes for some people really struggling, and we want to help address that. Public Wi-Fi, this one is one I'm excited to be able to bring to many of our communities. This mostly, I imagine mostly our rural communities are going to be interested in this because of the limited availability of broadband in many of our rural communities across the state. So this is to provide new or expanded public Wi-Fi services. This is to go for either the cost of the equipment or the service. One thing that I want two pieces that I want to stress. This Wi-Fi service must be located in an easy to access location for the general public. So wherever you plan to locate this service, it must be available and easy to access by everyone and all of your residents. Additionally, we have seen some questions in the previous round about providing Wi-Fi for local government operations. CDBG cannot be used for the general conduct of government, and so we are not able to use these funds to provide Wi-Fi for local government operations. So this includes providing Wi-Fi for your police department or your street department or anything like that. Now, a Wi-Fi hotspot can be located at a government facility if that facility has a parking lot right next to it, and that is where individuals can go to access the Wi-Fi. But again, it cannot be directly related or used for local government operations. So if you have questions about that, again, please just reach out. We are also encouraging communities to partner with broadband providers. So as everyone knows, OKRA runs the Next Level Connections program. And so we have, we talk with broadband providers regularly. And we know that there are some broadband providers out there that are actually already doing this, of providing public Wi-Fi. And so we know there are providers that are interested in partnering with communities and assisting in providing this type of service. So that is why we, encourage you to partner with broadband providers. The best suggestion we have is to, reach out to the providers in your area and just reach out to providers in general to see if they are interested in this. You also, we do have our Indiana Office of Broadband and our Next Level Connections people. While they are not going to be able to directly recommend someone for you to partner with, they may be able to provide you some ideas of those providers that are within your area or that you could potentially contact, or how to contact them. So again, just reach out to us if you have any questions about that. Many of our communities are very aware of their broadband providers. So again, and one of the big reasons why we're providing this is as we've seen with this pandemic, access to broadband is a necessity, and that is because of the need for accessing online learning, telehealth, or online assistance programs. And in some of our communities, that is not, many residents don't have access to that. So that is, kind of why we are looking at providing this. This is short-term in nature, and we are not looking to actually deploy broadband or develop broadband within an area. This is, again, limited to those public Wi-Fi hotspots. So food bank or pantry services, we, had this activity as part of phase 1. And so we know that many of our communities are continuing to see an increased demand in their food pantry services, due to lost jobs or other things related to COVID. So we are, this activity is to expand food bank or pantry services to help address that need. This can go to operating costs. We are not looking for, this is not looking to purchase equipment, but it can be used to lease equipment. So, if the food bank or pantry is needing expanded freezer capacity, and they can achieve that by leasing equipment, that's kind of what we're looking at. But this can go for utilities, payroll, food, any of those types of items. For this, the community must partner with an existing food bank or pantry. So we are not looking to set up any new food banks or pantries, but we are looking to help those that are already existing either expand their capacity. And again, that's, expand the capacity of food provided to people, or expand in their area that they are serving. Those are kind of where we're looking at. So subsidence payments. So this is very new for us in Indiana, and this is one that comes with a lot of complexity and also a lot of risk of repayment because of the way the federal regulations are written. So the activity is established as subsidence payments, and basically those are payments rent or utilities that end up going directly to the landlord or provider, and those payments are for individuals that are LMI. So, typically we have the 51% threshold for our activities. However, for this activity, based on what we are seeing, all individuals served by this must be 100% LMI. So everyone served must be from a LMI household. Also with this, we will be providing some technical assistance. We will be partnering with IHCDA, so that will be available. And we will be encouraging anyone that is awarded a grant for this to participate in that technical assistance. We are also going to be requiring a phone call with any applicant that is interested in this to discuss the capacity needed to carry out this activity at the local level. And applicants will have to certify via a letter that they have the capacity to carry out this activity. This is an activity that is going to require a lot of resources at the local level to manage this program. And we, in looking at this, our partner IHCDA set up our state rental assistance program, and based on their experience, we are seeing that it takes a lot of capacity to do this. IHCDA is a very large organization that has a lot of capacity, and when they announced their rental assistance program, they had an all hands on deck approach with it, just to handle the demand and all of the requirements around it. So again, we definitely see the need for this, and we know that communities are struggling with high numbers of evictions or utility shut-offs. But we also want to be transparent and honest with communities about the capacity and complexity of this program. For the recipients at the local, those individuals that would receive these payments, they would have to be LMI. They would have to document that non-payment of rent or utilities was directly related to COVID, and they will have to verify need for assistance via a completed duplication of benefits form. So again, there's lots of complexities with this. We definitely see the need, and we will do what we can to assist communities that are interested in this program. But again, we want to be transparent about the complexity of this program. Finally, we are going to also offer the activity of providing grants or loans to small businesses. These work the same as they did for Phase 1 and Phase 2, and loans have similar terms that we had with Phase 2. So, these go for operating costs and to help retain jobs for many of our businesses. We saw, so many of our businesses have to shut down in the initial wave of COVID, and now we are seeing businesses again having to shut down or discontinue operations for a time because of COVID or spikes in COVID cases. So we know this is a continued need, and our know that communities need these types of programs. So again, for the loans that are awarded from this, it can be up to $25,000 per business, 2% interest, 1% loan administration, monthly payments, monthly, quarterly, or annual payments over a 3 to 5 year term. Payments can be deferred. Balances also can be converted into a grant. That is one thing that we are, stressing. There is a difference between converting to a grant and a forgiven loan. And so, this is one thing that communities that are going to that, basically want to convert to a grant, that is what this program is doing. It is not forgiving loans. So, that is one big thing. And then, of course, there are the annual reporting requirements for this. If you have questions about providing grants or loans, your community liaison is a great resource, but we also have our expert on staff with Abby. And so she can also help and you as you develop this program if it's new or expanded. So that is all the information that we are, providing today for Phase 3 and an overview of our program. Your community liaison is going to be the best source to reach out to, and if they need input from any of the CDBG staff or possibly other partners, then they will work with you as communities to connect you with those resources. So here's, our standard map with all of our community liaisons on it. So please don't hesitate to reach out to them. Also, we have our great CDBG staff team here at Okra. So with myself, any general questions that you have, you can reach out to me. We have Abby Chapman for economic development questions or those grants and loans to small businesses. We have our electronic grant management system expert with Matt Wakefield. So for those of you that are not going to be using a grant administrator and have questions about our GMS system, Matt will be a great resource, or of course your community liaison. And then for those of you that have questions about certified grant administrators or grant administrator certification, our newest staff member, Blonley, is a resource. With that, we are going to be offering certification training for individuals that want to get certified next in 2021. We hope to announce those dates in January for that training. So that will be coming. So now at this time, I do want to open it up for questions in the last few minutes of our time. So as we have used for other presentations, we are going to be using the raise hand function, and then we'll just go down the list as as those are raised. So we will call on you and then unmute you once when we get to you. So it looks like the first individual with a raised hand is Debbie Bennett. So Kelly, if you can unmute Debbie. Debbie, you are unmuted.
Thanks, Eric. I just wondered if you would expand a little bit on the national objective for Wi-Fi and mental health and the food bank. And more specifically, I know some of them can be through intake documentation, but in general, like the Wi-Fi hotspot, is that to be located in a low to moderate income community because everybody will be able to access that?
Yeah, so for mental health, the national objectives that would be that make the most sense are LMI area or LMI limited clientele. I imagine most communities will do LMI limited clientele and do income verification for that one. And that also applies for food banks of either LMI area or LMI limited clientele. But again, I imagine most communities will do limited clientele with intake verification or intake forms and income verification. For Wi-Fi, that one we are looking at an area basis because everyone will have access to it. And so you will want to use that area basis one.
Okay, that's it. Thanks.
Not a problem. So next we have, I believe, Gage Pace, and you are unmuted.
Yeah, thanks, Eric. I am just wondering, I'm not familiar with the term LMI.
Yeah, and so LMI stands for low to moderate income, and so it is basically low income is income at, and I'm going to mess this up, 50% of the median income or average income for an area, and moderate income is 80% of the average income for a defined area. And so those numbers, that is defined by HUD, and we have census data that provides that for geographically defined areas. So such as if you take a city in Indiana, we have a tool that we can look at the geographic area that city covers and define the LMI percentage for it.
Cool. Thank you.
Yeah, no problem. So next we have Sarah Lamping. Oh. And Sarah, you are unmuted.
My question, is there any aspect throughout this whole phase 3 that would help address sole proprietors?
So that's a term that in phase 2 we ran into a lot of issues with, and so we are sole proprietor for us. We use that term as that is a type of business entity. So we are, that is something that we are able to assist, but it depends on how it is set up and how everything works. So what we ended up kind of determining, and Abby, I'm going to ask you to jump in on this one, that we are able to help them, but we need to look at those individually to determine whether they not. There's also this thing in CDBG called micro enterprises, which is a business of 5 or less, and we are able to help those. So we are able to assist those, and again, it's the wording that that we need to watch for. Abby, do you have any other comments?
I guess I would add to that independent contractors then, like your hair salon, your stylist, or your massage therapy therapist, or those that are just independent contractors.
Yeah, Abby?
Yeah, I mean, we've definitely worked with some communities that have funded those individuals. Again, it's really just letting us know what the situation is. We can always talk through it. You can send me an email saying, hey, here's the situation. We can kind of talk through whether or not they meet kind of the standards that we set. But we have worked with those individuals before, and just as Eric said, it's really just making sure overall that they meet, again, the LMI, but also just the standards that we've set. So I would just, we're definitely not saying that we aren't doing it, but just contact me as you continue to, if you apply for the grants and loans, and we'll work through it kind of in your specific case. Does that help? I know it's kind of gray.
Yeah, I guess my question is, did we miss the boat on that opportunity in phase 2?
Eric, you can correct me, but I would say no, not necessarily, right?
Yeah, no, I mean, it was still an option in phase 2, and we had many communities that did provide grants or loans to those types of businesses.
Yep.
But can they still be used with this opportunity as well in phase 3?
Yeah, I don't see why that wouldn't be.
We'll follow it pretty similar standards as we did the past 2 phases. So yes, we will consider them in micro enterprises as well.
Okay, good to know. Thank you.
No problem. So next we have Adam. Adam, you are unmuted.
Awesome. Thanks, Eric. I guess my question is just about, in phase 2, the city of Shelbyville did small business grants, and we granted to 36 or 37 different businesses. Shelby County is now interested in going after that same program. There were obviously some businesses outside city limits and other small towns throughout the county that didn't qualify for our grant. Is there any issue with the applicants or the recipients from our grants also applying for the county's grants? And along those same lines, if the city goes for another round of small business grants, can any of those businesses apply again?
Yeah, so that comes down to the duplication of benefits question. So as long as a business continues to have need and they can document that need for assistance, then they can receive these funds. So for us, we defer kind of to you all as a community of, do you want those businesses to be able to reapply, or do you want to open it up to new businesses first? We did have one community that opened it up, did one round for new businesses, and then any funds remaining went to businesses that needed additional assistance, so that had received funds prior. So that is kind of where we leave that up to the discretion of the community. And as long as there's no duplication of benefits issue, then we don't have an issue with it.
Okay, so as long as they can keep showing a need for the funding and the need, qualifies, then we can, in theory, they still qualify and we could grant that. Is that correct?
Yes, that is correct. Yep.
Okay, thank you.
Yeah, not a problem. So then we have our next individual, and Kaisha? I feel like I just really butchered that, so I apologize. But you are unmuted.
Can you guys hear me?
Yes.
Hello? Oh, okay.
Yes.
So my question was specifically around if I'm a smaller nonprofit organization, is this a grant that I could apply for? Is this for, grants for large organizations?
So for all of our grants, a local unit of government must apply, but then for activities like a food bank or something like that, a community can choose to work with a local nonprofit organization as a sub-recipient. So a small nonprofit would not be able to directly apply. They would want to work with their local unit of government to apply.
Okay. Thank you.
No problem. And then Janet is next.
Believe it or not. Can you hear me?
Oh, there you are. Yes,
okay, sorry. So we have a couple of employers that are fairly large in our county, and they actually are nonprofits, and thus we're not eligible for receiving funding through our county or town in the last 2 rounds. And so definitely one of them can be helped out with the child care expansion here. But is there room in this round to provide grants to retain LMI jobs if they're working for a nonprofit?
So no, unfortunately, based on the HUD regulations, grants and loans for job retention, they must be for-profit businesses. So nonprofits are not eligible for the grants or loans.
Okay, thank you.
Yeah, no problem. Next we have Lori. And Lori, you are unmuted.
Good morning. Quick question on the mental health and substance abuse treatment. Would a community corrections program be an eligible partner if we applied through the county? Because those people are serving a sentence, but they are in a community setting. So they go to the community place every night, but they go out, they work during the day, but there's a very high need for substance abuse and mental health counseling with that population.
Yeah, we would have to look at that situation specifically, so I can't really say yes or no right now. Because, yeah, we'd have to look at it specifically.
Okay, thank you.
No problem. Next, we have Cindy.
Hi, this is Cindy, and first of all, just thank you for all involved in the OCRA group and making this round 3 available. I know you've gone through tons of work to do this, but I'll try to keep these questions brief. My first one is, when we're talking about Wi-Fi service or perhaps assisting with lease and utilities for childcare, is there a time frame that we must adhere to?
So the time period that we are going to set is a 12-month period. So it's 12 months from award.
Okay.
Yeah.
Yeah. And the second part, when we're talking about the subsidence payment assistance, when we're looking for or someone that has the labor capacity to make that type of program happen, are we able to partner with other organizations that currently do that, like a community action, if we're able to serve a population different than what they currently serve? So I know here in Western Indiana, ours can assist those at 200 to 250% of poverty, but anyone that's not within that level is not eligible for their program.
Yeah, I think that's going to be, a situation that we're going to want to look at the details about and see how those align. The biggest thing that comes to mind there is the duplication of benefits piece and how we address that. So that's going to be the big there, yeah.
Okay, well, I have them kind of checking into to whom they're not able to serve that are, they're getting requests from. So, and my last question is for any partnerships, whether it be a food bank, a nonprofit child care, or a for-profit child care, are there specific agreements that OCRA is going to want to see signed by both parties if they're a subrecipient of these funds?
Yeah, we will want to see our standard subrecipient agreement.
Okay.
Yep.
That's it. Thank you.
No problem. Next, we have Nancy. Nancy, you're unmuted.
Yep, I'll try again. So good morning from Brookville. Eric, will there be a link provided to the slide presentation?
Yes, we are recording it, and so we will be posting the presentation and the recording on the COVID-19 webpage on our website.
Okay, great. How about a PDF?
Yes, it will be. It will be also there.
Okay, great. Thank you.
Not a problem. Next, we have Matt. Matt, you're unmuted.
Yeah, hey, thank you, Eric, and thank you for hosting this today. It's much appreciated. I did have a question. If a community wants to help a food bank or look at some of the public Wi-Fi options, does procurement apply to those purchases?
It does. Again, we are in, because of the COVID situation, we have some different procurement options. So if there's a question about what all the procurement options are, they need to reach out to their community liaison or grant services.
Okay, thank you.
Not a problem. And then just 3 more people that have their hands raised. So we have Dean.
Dean,
you're unmuted.
this is Dean from Spencer, Indiana. Couple things. We participated in phase 2, and for grants, there was a maximum of $10,000. Is there a maximum in this phase 3? I noticed 25,000 for loans.
Yeah, and so at this time we don't have that. We're kind of letting the community determine that, but we would encourage it to be reasonable. Because that's going to come in. It could impact your competitiveness depending on what you vote. Yep.
Okay. And then for some of the other eligible activities, the public services, I guess there's not any kind of dollar amount maximum on those either then. Is that correct?
I mean, those are subject to the maximum grant amount of $250,000.
Okay. And then what about an entity like a nonprofit similar to a YMCA? What kind of assistance could we provide for them?
Well, and so, I mean, depending on so with nonprofits and CDBG, nonprofits have to provide a service.
Okay.
And so, if the YMCA is providing child care service, then they could potentially be a subrecipient for the child care activity. If they are providing a food bank service, they could do that. So that's kind of where the nonprofits fit in. They fit in as a subrecipient of providing one of the services.
Okay, and then so for any of these eligible services, are they going to be receiving the money as a subrecipient and require a subrecipient agreement and all that?
Yeah. Yep.
All right. Great. Thank you.
No problem. So, Tara, you're next, and you are unmuted.
Hi, good morning. I actually have a 2-part question. For the regional collaboration, if you have some unincorporated communities as well as incorporated, which would, they would meet the LMI requirements, what if each one of them have a separate eligible activity need? Is that something that could be combined?
Oh, go ahead. Sorry.
Is that something that can be combined in this application? And also, how would the application receive the LMI eligibility for each one of those? Just basing it off the map?
Yeah, so we'll do for those, there is a multiple activities option, and any communities that are interested in using that will end up having a call with me, and we will discuss the specifics of the situation and how best to submit an application. So we'll talk about, the LMI and everything like that. We'll talk about how best to submit that application. So there is a multiple activities option where you do multiple of the eligible activities, but because each of those situations are very variable, we are just going to do a phone call to get those figured out.
Okay, great.
Yeah.
Thank you.
So, and these are the last 2 questions that we will take today just to respect everyone's time. So, Cindy, I think you have another question. You are unmuted.
Just a quick question on the eligibility for the LMI. So if we were to do something to assist a child care provider services, is the LMI based on the families of the children that are in that care provider service?
Yes, that traditionally is how that has worked.
Okay, thank you.
Yep. And then Sarah, for our last question.
If we apply for a grant and from a regional standpoint, is the LMI going to be aggregated?
So it depends on just how that all works, and again, depends on details of the situation. So again, that's where I would say we would look. That would be something to talk with your community liaison, who will probably pull in either myself or Matt Wakefield on. So it depends on it. There's lots of different ways we can look on it depending on the details.
Okay, thank you.
No problem. So with that, we will conclude the overview today. Appreciate everyone very much and all of the great questions. Again, if you have any other questions, please don't hesitate to reach out to your community liaison. And I hope everyone has a great rest of their week. Thank you very much.